The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Now, before we get started, I'd like to introduce our speaker. Dr. William Parker is an associate professor of surgery at Duke University School of Medicine. His research interests include the pro-microbial aspects of the immune system and investigating the immunological differences between laboratory-raised and wild-raised animals as a probe for differences between humans with and without modern medical care, respectively. This comprehensive approach has turned up unexpected and dramatic differences between the unhygienic and hygienic populations. You can type your questions into the questions section now and throughout the talk. These webinars are made possible through generous donor support. If you'd like to contribute, please visit our website at autism.com. And now I'm going to turn it over to Dr. Parker.
Thank you very much. It's a pleasure to be talking with you all today. It's, I guess, a hot topic right now in the field of autism regarding the helminths or intestinal worms and how they affect patients with autism, or how they might be responsible in part for some of the symptoms in patients with autism. We covered some of the information that I'll cover here back in the summer, but there's a tremendous amount of new information, a lot of new slides. I'll start out with a summary of overall where this is going. And we are finding some benefits of helminths in patients with autism. I'll cover that in substantial detail in a little bit. And our studies are retrospective. They're looking at patient-reported outcomes as well as interviewing medical doctors who are observing patients that have autism and are using helminths. There are some adverse effects of using helminths, and we'll cover those in detail. Again, as a reminder, they're not controlled clinical trials, so it's the information we have is not at that level of certainty, but we do have quite a bit of information. I'll show you what we do have. There are some rumors now, and if many parents are convinced that helminths are causing some problems in their children, and I would just encourage those folks to stick with the talk. I'll show you the data that we have and how we can tell what's going on, how we know whether or not a helminth is at fault or not. And I would say that in this case in particular, we don't discount parents' observations. We understand those, and I think to understand what's going on in these situations, we do need to be able to account for the observations made by the parents, and I think we can do that, and we can do a good job of it. So the first thing we want to look at is, do helminths actually work? Do they help the immune system? Do they help people with immune disorders? The best trials that have been done were prospective. In other words, they were looking at it in advance. They had randomized and placebo-controlled studies. Those were done with inflammatory bowel disease. Now, prospective trials were also done with multiple sclerosis with excellent results. Those weren't randomized, though, and those aren't placebo-controlled. In my studies, they're retrospective. We're looking back in time, so it's not to the level of certainty that the other studies are. So inflammatory bowel disease, multiple sclerosis, those are prospective. Mine are retrospective. Again, not as much certainty, but we do have a lot of very compelling data dealing with depression and anxiety disorders. I'll show you that data as well. And as I mentioned before, we'll show you some data that we've collected from patients who have autism and are self-treating with helminths. So first, I'll talk about Joel Weinstock's data just for a second. He had a number of patients that had inflammatory bowel disease that were not responsive to drugs. He gave them the porcine whipworm, or also known as TSO. And when he did that, he got a cure rate of more than 70%, which is very, very impressive compared to modern pharmaceuticals. And I use the term cured because we look at that helminths as exercise for the immune system. Of course, you take away that exercise, then the disease will come back. But as long as the helminths are there, then the disease will be not there. One of the most interesting studies done in the field was in Argentina. They had about 500 patients with multiple sclerosis, and some of them got accidentally colonized with the helminth. When that happened, they tracked the patients. They also included an uncolonized patient as a control, and what you can see is that the colonized patients basically did not experience any more advances in their multiple sclerosis. Their multiple sclerosis stopped progressing. Whereas the uncolonized patients, as is the case in multiple sclerosis, continued to get worse. That was, again, almost 10 years ago now, and a very impressive study. The studies that we're doing are looking at patients who are self-treating. We do have some degree of certainty, but again, it's retrospective. We're looking back in time. The trials aren't controlled. This past summer, I talked in detail about some of the information we had. In white, there's 4 parts of our study here, 1, 2, 3, and 4 on this slide. The first 3 parts we had done this past summer, and I talked about those to some extent. The analysis by a psychiatrist of our surveys is new, as well as interviews with medical doctors. I think the interviews with the medical doctors that's where we gained the most, number 1, detailed information, and number 2, the most information about patients with autism. As patients with autism tend to, number 1, go see their doctor even if they're trying alternative therapies, and number 2, they do tend to try alternative therapies more often than most individuals do. So in our survey studies, I'll just show you some data here from anxiety disorders and depressions. We had 6 patients with anxiety disorders, 7 with major depression. And in each of those cases, the patients in their survey give us 2 numbers. In this case, we separate the numbers by a slash. So for example, if you look at our 6 individuals with anxiety disorders, there's 6 pairs of numbers. The first pair is a 9 and a 0. The 9 represents the effectiveness of the helminthic therapy, and the 0 represents the side effects of the helminthic therapy. So obviously those numbers are very good. When they're bold and underlined, that means we can tell that the individuals were using too low a dose of Helminth. They increased their dose, they would get more effect, still with relatively few side effects. These individuals are using a worm called the HDC. It's commercially available now. Some people farm it themselves. And again, I think they're getting a good result. It's not a prospective study, but we're looking at patients who, and you can see down in the little box below, the average that these patients have been sick is almost 30 years. So these are very chronic conditions that they've had. We don't think there's a large survivor bias in this study. There are several biases that you're prone to have when doing these kinds of survey studies. The survivor bias we've eliminated. On the next slide, you'll get the reference for the original study. This particular information here we just submitted for publication, though. In the original study, we did have some data on migraine headaches. Again, looks very promising. It's the same. The first number for each of the 4 participants is the effectiveness. The second number is the side effects that they experience. Now, one of the things that we're finding with helminthic therapy is there are rare side effects that happen sometimes. So the more numbers that and this is true of pharmaceuticals as well, the more numbers you get, the more you find out what's going on with rare side effects. But you also get a much better feel for how the average person responds. In this slide, you're looking at the kinds of diseases that on the left we know are associated with what we call biome depletion. So biome depletion is when this state that we all live in now where we've lost our helminths. Back in 1800, everybody had a helminth, or they had a helminth at one point and were regularly exposed to helminths, whereas nowadays, by and large, helminths just don't exist in North America. There's some exceptions with a pinworm in children, but by and large, the helminths are very rare. So by confirmed, what we mean is we can add back in a helminth either in animal studies or in humans in some cases, and show that when you add back in a helminth, you attenuate or you effectively cure the disease. Highly probable, in the highly probable category, we've got a list of diseases that are associated with gender. Typically, they affect females more than males after puberty. They are associated with inflammation, and the epidemiology suggests that in our modern society, these things happen, whereas in a pre-industrial society, you would not have seen any of these diseases. Very suspicious just means that it's got a lot of the, not all of the hallmarks of something that we expect from biome depletion, but it's got a couple of, two out of 3, 2 out of 4, something like that. And again, there's a reference there for more detailed reading on that. So I've given you a little bit of information about how we know that the helminths are affecting the immune system. I want to back up a step and talk about the basic science and why we think the helminths are affecting the immune system, or how does all this work. So first of all, as I alluded to before, in Western society, there is a tremendous amount of immune dysfunction. We think that the human immune system is essentially like a car that's not tuned properly. Has a lot of issues, include cancers associated with inflammation, heart disease, and certainly allergies, autoimmune diseases. And then more recently, within the last decade, we found that a wide variety of cognitive disorders, including autism, depression, anxiety, schizophrenia, are all associated with inflammation. This is a quote by a world-renowned experimental psychologist who's also a collaborator of mine. The bottom line is that it is becoming mainstream to appreciate the connection between inflammation and brain function. When we think about immune dysfunction, we know that it's not just biome depletion. Now, the idea of biome depletion, or the biome being the life associated with the human body, and the idea that we've lost a lot of that life because of our toilets, because of our clean drinking water, because we live indoors, that originally came from the hygiene hypothesis. But there's other factors which interact with our body, which act in concert with biome depletion to destabilize immune function. And inflammatory diets are right at the top of the list. A sedentary lifestyle is bad, and certainly chronic psychological stress. I'll show you just 1 or 2 slides on that later on. And vitamin D deficiency all work together with biome depletion to destabilize immune function. So we find that although biome enrichment can help a lot of people with immune dysfunction, it's not controversial to know that dealing with these other factors is also very helpful. The one thing we like to keep in mind when thinking about helminthic therapy is that it should work in concert with a healthy lifestyle, eliminating these other factors that we have in Western society. Now, it was Kevin Becker at the NIH who first came up with the idea that autism and biome depletion are connected. It was a very nice paper published in Medical Hypotheses. He gets the credit for that one. Now, when we talk about these factors in our society which destabilize immune function, it's important to acknowledge that all 5 of those factors, and again there's 5, the vitamin D deficiency, chronic psychological stress, inflammatory diets, sedentary lifestyle, and biome depletion, all 5 of those interact with our genetics, and they interact with environmental triggers to cause disease. So yes, genetics are important, but they're not the cause per se of the disease. So the easiest example is hay fever. Hay fever did not exist in 1800. The The incidence rose dramatically in the late 1800s and continued to rise throughout the 1900s. So there is a genetic predisposition for hay fever, but the genetics don't cause the hay fever. It's something in the environment that changed that's causing the actual disease in this case. But it is associated with ragweed pollen, which is the trigger, and it is associated with certain genetic influences. This is a very specific model that we have for autism in particular. In this model, on the top left, you have those factors, the 5 factors. I think sedentary lifestyle is not listed in this one, but the 5 factors that lead to a kind of a vicious cycle of inflammation and oxidative stress. Then with the right timing and genetics, you can get autism. I want to back up just one step and talk about acetaminophen in this case. Acetaminophen is obviously it's Tylenol, or a commonly used analgesic or drug to relieve pain and fever. There's a substantial connection between acetaminophen and autism. So if you're interested in this, there's several individuals, references are given here, that have written about that. The mechanisms that they have are plausible. I'll point out here that, this is something that I didn't cover back in the summer, is that the mechanism by which acetaminophen causes injury to the developing brain is most likely very different than the mechanism by which acetaminophen or Tylenol can cause liver damage in adults. So as acetaminophen is processed rapidly by an adult liver, it can lead, under certain circumstances, it can lead to a buildup of metabolic toxins which can cause liver damage. And babies are not very susceptible to that because their liver doesn't metabolize drugs very quickly. They just don't have the same potential to do that. So what we think is going on with the brain damage is unrelated to what caused, say, with an alcoholic who takes Tylenol, or somebody who drinks a considerable volume of alcohol and then takes Tylenol. That's a very lethal combination. And there's very different things going on there than we anticipate would be going on in a developing child. Since I gave the talk in the summer, a study has come out now looking at pregnant mothers and the risk of autism with acetaminophen use. And there is a 70% increased risk for a certain type of autism with the use of acetaminophen. And that's only 25% of the total cases of autism that's associated with the hyperkinetic disorder. That's not a lot when you consider all the other risk factors that are out there. Now, a 70% increase of getting a certain type of autism seems, obviously knowing that information is very helpful, but that doesn't account for the incredible rise in autism. It's what we're really interested in is what happens when you give acetaminophen to the baby or to the very young child. And it's a very different ballgame there. It's sort of comparing apples and oranges because the mother's liver is able to handle the metabolism of the acetaminophen, whereas the newborn baby doesn't have the mother's liver for protection. So the baby's liver naturally only has to digest mother's milk. It's not digesting a lot of drugs or other types of toxins. It's a very different process. So if you look at the rate at which babies are given acetaminophen, it is quite startling. A lot of babies are just given it at the time of circumcision. Here I've got a protocol from the University of Michigan, and not to pick on them, but they, this is a very similar protocol in many, many places. It's just they have theirs published online. And as you can see, they'll give the acetaminophen to a baby who's getting circumcised, and it says with the parent's permission, but for the most part, when you give permission for circumcision, you also give permission for pain relief. What mother would want circumcision without pain relief? So it can be assumed in many cases that you also give permission for acetaminophen. Many of the parents don't even know their kids got acetaminophen. It's just become that common. And it's also, of course, given quite a bit with vaccines, although it's known to attenuate the response to the vaccines. And that's supported strongly by some physicians and not by others. In the end, what we find is that there's no single factor that has as great a risk that's been associated with autism as the use of acetaminophen in babies, not in pregnant mothers. There's a risk there, but it's not that in terms of all the things that cause risk, it's not that much. Now, acetaminophen does a lot of other things. It causes developmental delays when pregnant mothers use it, and can cause birth defects. So there's good reasons not to use acetaminophen if you can at all help it. And then there's a number of factors that have been associated with autism. You can correlate, I believe, the rate of autism with the amount of organic food sold. And of course, the amount of organic food sold, it doesn't cause autism. It's just a reflection of the amount of awareness of our food and how unhealthy it is. And so anyway, the point is that there's a lot of things that can be associated with the cause of autism, but nothing looks as promising to me, at least, as this connection with acetaminophen. So I'll get back on track here, back to why helminths. Helminths, they are one of the loss of the helminths is an underlying cause of inflammation in our society, and immune function is definitely disrupted in our society. So inflammation is associated with the induction of autism. I've got a couple of references down there. A lot of people have written about this, and of course autism is a very heterogeneous condition. Inflammation is associated with some cases of autism. So what induces autism is different than what is necessarily associated with autism 3 or 4 years later after it was induced. And I think this in particular is going to be very important when we look at what helminths are doing and how they're being used by patients with autism. We'll talk about this in more detail later, but patients who have autism and have other kinds of inflammatory comorbidities, say they have digestive problems or allergies, they're the ones who see the biggest effect from the helminthic therapy. And not all of them do. Well, again, we'll talk about that data in a minute. And of course, neuropsychiatric disorders are associated with inflammation. And again, the inflammation is tied into helminths. That gives us a picture of why we're interested in helminths. A little bit more on the basic science. The helminths are part of what we call our biome. Most people working on the biome focus on the microbiome, the bacteria, but the helminths traditionally have always been part of the biome. They're simply, for the most part, lost nowadays. And together, that biome, which includes microorganisms and the helminths, interact with the human immune system. And the human immune system is responsible for the maintenance of the interaction that occurs between the human body and the environment. This is the way we sort of diagram it out and look at it, is that the worms and germs operate to some extent independently. They definitely interact with each other. We've done some studies on that. I'll show you one slide. In this three-legged stool analogy, the idea is if you knock out one leg of the stool, the rest of the system gets a bit destabilized. And I think that's a very helpful and productive way to look at the ecosystem of the human body. It makes a lot of sense in terms of trying to rationalize and explain the results that we're seeing with both the microbiome and helminthic therapy. This is the slide I promised you on how the worms and the germs interact with each other. The bars on the left show you the different kinds of species that it's roughly a species, not exactly, but for practical intents and purposes, let's say that every color represents a different species. These are some of my patients, which are rodents. They weigh about a pound and have a long tail. Each one of those colors represents a different bacteria. When we add a helminth, one helminth into the rodent, what you see is a transition from the red bacteria are indicative of a less healthy bacteria associated with the unhealthy Western lifestyle, whereas then you switch that to the purple bacteria, which is associated with protection from from allergies. It's a Bacteroides to a Clostridia family shift, but that's not important. The important idea is that you can't think about the microbes independently from the helminths, and by the same token, we don't want to think about the helminths independently from the microbes. Graham Rook has done a very good job. I think he's the foremost thinker in this field in terms of how changes in our environment have affected our biome. And as you see in the slide, it starts out looking at the helminths, or the worms, which have mostly been lost, and we have sort of mean-looking worms and friendly worms, because not all worms are friendly, and part of the game here, it's a game that, you know, it's a very critical game involving life and death, but part of that is to figure out which helminths are friendlier, they regulate the immune system and causing less side effects, versus which helminths are more aggressive and might cause more side effects. The separation of bacteria is a little more straightforward. There's a lot of our normal bacteria that aid in digestion, train our immune system. There's some from the soil that are very helpful. We have some diminished contact with those. By and large, I would argue that we haven't changed contact with those too horribly much for the average adult individual. There's certainly some exceptions. The bad germs are crowd infections, are things that we typically get vaccinated against. They're diseases of modern humanity because we live in urban environments. They're called crowd infections. Those do not train the immune system. They more inflame the immune system and can act as triggers for different kinds of autoimmune disease that happen in part because we've diminished contact with other parts of our biome. There's multiple factors which tend to destroy the helminths in our society. Just having canned food, for example, and preventing rats and other insects from getting to our food does have an effect. Wearing shoes blocks out a lot of the organisms which would be transmitted, say the hookworm, for example, that would be transmitted through the dirt and in through our skin. And then, of course, clean drinking water, toilets, just washing our clothes, getting the dirt off, all those kinds of things have a huge impact. It's not about hygiene, and we like to point this out on a regular basis. If I stopped washing my hands for the rest of my life, I would have tremendous social problems, but would still not pick up the helminths that I have lost. So it's not a hygiene issue. Washing your hands, we'll go back one slide. Washing your hands will help you avoid those bad germs. That's okay. That's a good thing. You don't really need the stuff that's on the light switch, the hotel room, or on the shopping cart handle. Moises Velasquez-Manoff has done a very good job writing about this topic. It's a general, easy-to-read book that's very comprehensive, I think. He also talks a lot about self-treatment with helminths and some of the drivers in that field that were initially there. I'm not going to talk about the science. There's a couple of references there. That little picture with the spots on it is just showing you a lot of different proteins that a biochemist has separated out. Each spot represents a different protein or glycoprotein. The references are on there if you're interested in more detailed scientific reading. So back to this, we've got so many things that are confirmed or either highly suspect to be associated with our loss of helminths and other changes in a biome, as well as changes in diet and exercise, chronic psychological stress. The question is, how did this sneak up on us? So if everybody got a toilet and then got sick the next day, then toilets would not have, they would have just become unpopular in the early 1900s, and that would have been the end of it. But that's not what happened. The toilets are slowly introduced, and our biome slowly changes over time. And just because you have a toilet and clean drinking water, it still takes years for the previous exposure to wear off. Then there's this issue of epigenetics, so it might not even matter so much if you have your biome depleted. It might matter if your grandmother had her biome depleted when your mother was born. And plus, biome depletion is not just within a household, it's a whole community. The whole community is involved in biome depletion. Just when one person gets a toilet and running hot water so they can use soap every day, it's not going to help a lot if nobody else in the community has that. And then lastly, and unfortunately, modern medicine doesn't really take into account epidemiology. So the fact that we know that hay fever didn't exist in 1800, therefore there must be something environmental that's causing that. That's not really on the radar screen of your average scientist doing biomedical research looking into how to prevent or how to treat hay fever. All right, I've done some work on this topic, the basic science. I'm not going to talk about it. I'll just mention it briefly. One of the things we do, I think it was mentioned in my bio, we do look at wild rats. I won this award for working with wild rats. And everybody says their rats are huge, but they're not actually that big. When we won the award, they did that painting for us to indicate a little bit about the job we were doing. We don't do all of our work in wild rats. In some cases, and in this case is a model for some of the kinds of inflammation that affect the brain that happen during the induction of autism. It's a two-hit model, very early in age, and then later in life they get immune hits. And these are all laboratory animals. The standard laboratory animal is what we call biome depleted. And then the biome enriched animal is when we add, there's lots of ways to enrich the biome. One easy way is just to add a Helminth back in. Then we can assess their cognition, assess their immune function. And yes, we find that adding a Helminth back in does protect the rat pups. Even before they get their own Helminths, just because their mom has a Helminth, their brain is protected from inflammation that we induce by giving them an infection in their GI tract. A little bit more about trouble with modern medicine and why modern medicine is having issues tackling this is, first of all, in modern medicine, we don't really know what true normal is. All of our healthy, quote-unquote, healthy controls are mostly biome depleted because they come from around us. They're biome depleted, they're chronically stressed, they probably have a bad diet, but they just happen not to be sick. So in that case, they don't have a healthy lifestyle, and in large part, they might not be sick just because of genetics. So some genetics work better in the current environment. That doesn't mean that the people who are sick have bad genes. That's not what that means. It just means that we have a bad environment, and because of that bad environment, a lot of people with certain genotypes are getting sick. This is a major problem, is that if somebody needs diet, rest, and exercise, for example, it's very hard to recapitulate that with a drug. And when you try to recapitulate that with a chemical or a pharmaceutical, you end up with, number one, an ineffective approach, and number two, an approach that has a lot of adverse side effects. As a scientist myself, I can say that it's very attractive for us to look at these kinds of detailed molecular genetics. I'm trained in biophysics. That's my background. It's fun, it's interesting, it's intellectually challenging, and we tend to gravitate towards that. So let's go ahead and talk about that. That's sort of the end of the discussion on the basic science of Helminths. Let's move on now to talking about what do we know about Helminthic therapy, how does it work, what are the pros and cons of Helminthic therapy, what all is available out there. One of the first things I want to point out is that there's the mainstream down on the bottom right that's working on Helminthic therapy, and then on the top left I've got the available companies that are selling Helminths. The ones that don't have a logo are the ones that produce what we call colonizing Helminths. In other words, those Helminths actually live in human beings and they produce eggs. They don't reproduce inside a human being, but they produce eggs. The companies there with the logo, they produce what we call non-colonizing Helminths. And worm therapy is now also producing a non-colonizing Helminth, but they also produce a colonizing Helminth. And we'll talk a little bit about the different Helminths and what they do. There's a tremendous dichotomy between mainstream medicine and the do-it-yourself, the DIY Helminthic therapy. At Duke University, of course, we're in the mainstream. Any time we would treat a patient, it would be with an FDA-approved trial registered with the National Institutes of Health. But what we do have permission to do is do a socio-medical study. In other words, look at the sociology of what's going on with the Helminth therapy, the do-it-yourself Helminth therapy, and what kind of results these people are getting. It's been suggested, not by me originally, it's been suggested that this is a great way to sort of gain an understanding of what the Helminths can do to help guide us as we design clinical trials in the mainstream. So as a part of that study, we're interviewing medical doctors. I'm working from the bottom up. We sent surveys out to patients. We've interviewed all the producers and providers, I believe, that are on the planet right now, at least all the major ones, and we're gleaning information from the public domain. Janet Wilson is a sociologist, a longtime friend of mine, is professor at University of Central Arkansas that's been helping me on this project for quite some time. I'm sort of glancing over here at the clock every now and then to make sure we're on track, have time for some questions. These are the different companies that are selling products. I've got Mother Dirt and Open Biome here, which sell bacteria. They get rave reviews for that by and large, but we don't track that as part of our study. It's just, this is in general the kinds of organisms that people are using. And if you have questions, you can ask me about those. We try to keep updated on each organism and what's known about it. And I might point out that Tanavisa, the top company there, it's been in existence longest, but it's changed its name and it hasn't had the product being sold the longest. So some of the other companies down there, autoimmune therapies and then possibly worm therapies as well, might get credit for having product on the market for the longest amount of time. This is updated from our last report. Right now, the non-colonizing organisms, the two top organisms, are more popular. They've just, especially the rat tapeworm, it's risen in popularity recently. It's less expensive than the porcine whipworm, but it doesn't have as much data behind it supporting it. The human hookworm and human whipworm are colonizing organisms. Again, those live inside the human body and will produce eggs. And again, they don't reproduce, they just produce eggs. So if you take, with any of these organisms, if you ingest 10 organisms, that's what, well, the top two, you have 10 organisms for a little while and then they die off before producing any eggs. The bottom two, they'll live in the human body and produce eggs, but they don't make new organisms. So it's not as if you ingested a bacteria which can reproduce. If you ingest 10 organisms, that's all you've got. And that's all you'll ever get unless you ingest some more organisms. Now we're getting into, I think, what a lot of people are interested in. There's some general principles about how Helminth therapy works with autism. And again, this is with a caveat that we're doing a retrospective study looking back. It's not prospective. It's not placebo-controlled. It's not blinded. We are interviewing medical doctors to see how they're seeing this. We're looking through the eyes of the medical doctors as they watch some of their patients experimenting with self-treatment in Helminths. So number one is, and all of the doctors that we've interviewed, there's 4 different doctors. We've interviewed other doctors, but they're not treating patients with autism. We've interviewed 4 doctors who are treating patients who have autism, and one of the main things that we see is that patient selection is very important. And they're trying to select patients who have allergies, who have neuropsychiatric issues that are comorbid with autism, for example, tics or OCD, something like that, that are known to be possibly affected by Helminths in adults, again, based on our retrospective survey studies. So if you are looking at a patient with autism but absolutely no other inflammatory conditions, they're in general not using Helminths and not seeing any benefit from the Helminths. The second thing on the list is it's something that we've observed. The parents are trying the non-colonizing organisms by and large. And then they do typically do that in conjunction with a physician-supervised therapy that includes behavioral therapy and dietary modulation. I feel like on number 2, it's important to note that the parents have a huge role in the decision process. Obviously, these children are not deciding this on their own. So I think technically it's referred to as self-treatment, but and obviously the parents have the interest of the children at heart. So that's an important thing to keep in mind when looking at this. It's a little bit different ball game than most of our previous studies, which are just looking at adults self-treatment. And the fourth thing down there is dosage is very important. It depends on which helminth it is. It depends on how the helminth is formulated, especially for the HDC. For the TSO, there's really only one formulation of helminth that's used for self-treatment. The other formulation, which was apparently less effective, unfortunately, was used in clinical trials. And that information, we published that information already. And if you have questions about that, please do let me know. First, let's talk about what we see with improvement. We've got 4 physicians here, and each is treated, I think 70 patients is the minimum number that any one of the doctors has observed. And one doctor observed a 97%, as it was 68 out of 70 of the patients did better, and 2 actually had an adverse reaction that we'll talk about on the next slide or two. 97% is very high. I think the patient selection was very, very important in that one. Most of the other physicians are reporting, as you can see, substantially lower numbers of patients, but it's consistent. Around 50% do give a positive response, and then the other half just have no improvement. And again, this is after some patient selection, looking for only patients who have comorbid inflammatory conditions. I'll just stop here just for 30 seconds and let you read through the slide. There's no point. I'll point out that these are the same exact things that we see in adults with helminthic therapy. We've been tracking this for a few years now. So they're just conditions that happen to be comorbid in patients with autism. So we're not seeing a lot of difference between the adults and the children with autism with any of this. We are getting more detail from the physicians than we've gotten before from self-treaters, but it's all consistent with the kind of information that we got from self-treaters. And this, I think, is very important here as well, looking at the adverse reactions that we're getting. The two out of the 60, or 2 out of 70, 2 did well, 68 did not. That the one doctor mentioned, the 2 of them, the reason why they stopped therapy was because they were getting that top problem there, which is increased hyperactivity. I've got 3 different bullet points under that increased hyperactivity, and the reason is because different doctors that I've interviewed have different ways of dealing with that. So one of them treats it with ibuprofen. One of them just ignores it and allows it to pass. And actually, there's a couple of them that ignore it and allow it to pass. And then one of them has learned how to avoid that by ramping up the helminth dose in a much slower fashion. So don't just jump in right where they think the therapeutic dose is going to be. They're again, it's self-treatment, but the doctors are interacting with the patients and telling them what they know. So one of the things they'll tell them is, ramp up the dose slower, then you don't see those kinds of side effects. Now, the last one down here is a very severe adverse GI symptoms, and we see that in adults with other types of helminths. So, for example, the hookworms, a lot of people will have severe GI distress, especially if they're using a high dose. So, it's in less than 1% of the pediatric population, but of course, people need to be aware of this. It could happen, and then the helminths need to be removed, and they are effectively removed with anti-helminthic drugs, because severe cramps in a child obviously it's not what you want. It's not something that'll put somebody in the hospital, so it wouldn't be considered a severe adverse reaction according to FDA standards, but again, it's not something you want a child to have to endure. it has been observed only in nonverbal or mostly nonverbal individuals less than 8 years old. Most of the old reports that we saw in the literature before looking at self-treatment with helminthic therapy suggested that when patients do have a reaction to HDCs, that they're typically very young patients. And in this case, you've got a typically non-colonizing organism, an HDC, and it actually colonizes the child. Again, it's known to happen. It's much more rare, apparently, in adults. But a lot of the colonizations are where the organism grows to adulthood and begins producing eggs, but not reproducing. Those are asymptomatic, so we're not entirely sure how often it does happen. We're probably going to determine that when we do clinical trials. So real quickly now, just I'm going to address some issues with, and then I'll probably take a break and ask for questions. To try helminthic therapy or not, this is a deeply personal question. It's not something that I can't give any advice. I'm not a, we'll talk about who's allowed to give advice and who's not. I am certainly not allowed to give advice, but there's a lot of things that people consider. I've talked a little bit about the risks and the benefits. I think there's two issues I can address. What does my physician say, and when will FDA-approved products be available? So the mainstream FDA-approved product route is just very slow. This is kind of an indicator of how it's gone with the TSO or the porcine whipworm. It's taken 10 years, and we still don't have. They started some clinical trials, but the product was misformulated. Apparently, it's been the failures of the inability to reproduce the original work by Joel Weinstock in 2005 has been attributed to a change in the formulation, and certainly that was a difference between what was done with the trials and what Joel did. Some trials have been done with the hookworm, although they're using what's known to be subtherapeutic doses of that worm. And of course, the trial I've showed you the data with in about 2007 down there at the bottom left. The Helminths halted the progression of relapsing remitting multiple sclerosis. And of course, that really hasn't been followed up on. We did confirm in our socio-medical study that hookworm does work for MS. That's at the bottom right down there. And that's when we identified the Helminths. Now, I'll show you the next slide sort of behind the scenes on what goes on with the mainstream medicine. This is my own experience. It's about over 5 years ago now when a science writer first contacted me and said, hey, there's a new organism out there. At that point, everybody was pretty much waiting on the TSO. We heard good things about it. It took a couple of years to write up a study, get that approved through our institutional review board. Then we collected that data, looking at a couple of more years, and to get enough data to say, hey, I think this is compelling. Clinical trials should be done. It wasn't covered by patent the way the TSO is, so we had a more direct route to go straight to the FDA, and we're working on that. As you can see on the bottom right, we have to get funding. We write the grant applications. It's not complaining. It's just the way this system works. Is that I had 2 rejected just within the last month. It's okay. It's the game. It's the game that we play that I know is a life and death game, but you have to what's the British? Keep calm and carry on. That's the only way to get the job done. So we do have some funding now to clean up the helminths according to the regulations, which are not. It's not good for the helminths. I mentioned up here in the top right that it's not very productive to follow those regulations, but that is what we have to do. I believe that we will be able to get this to work, or I wouldn't be continuing to spend my life on it. The idea is that you can't wait around for a long time on mainstream medicine because, you will have to wait a very, very long time. And hopefully within the next few years, but we just don't know. This is a great cartoon showing part of the problem is that helminths are just not popular right now. Science is a very trendy thing. And there's right now the microbiome and genetics are very popular. But it's not helping with getting the helminths done. It's just a matter of science has to go where the money is. And without the money, you simply can't get the research done. And then the last couple of slides I'll show you is what do physicians say. Now, of course, for any physician to recommend something, they need to, number one, know the patient, and number two, they need to be knowledgeable about the therapy. If they're not, then they shouldn't be speculating, and to do otherwise, to speculate could cause harm. So it's best just to do no harm. Sometimes it's hard for a physician to say, I just don't know, I'm not knowledgeable about that topic. It is a deeply personal decision, although some mainstream system physicians alike will just discourage the use of helminthic therapy. It does equate to personal medical advice, which is not necessarily ethical. It does ignore, if you typically when a scientist, for example, which I'm most familiar with, will say, oh no, we shouldn't be doing that. They realize that there's a lot of unknowns with helminthic therapy because the controlled trials haven't been done, which would be the next part of the slide. But there are a lot of unknowns. But then, of course, the nature of the disease is also a huge factor, and a lot of times it's not considered when making these blanket de facto statements discouraging helminthic therapy. And then, of course, in the mainstream, I'll go ahead and skip past this. I do want to, there's one more topic I think I want to cover, and that is that, and I'm showing you a really disgusting slide right now. These are helminths that I can recognize. These half asleep with one eye open. There's the whipworm, it has a distinctive shape on the bottom left. The tapeworm, very distinctive shape. The roundworm, and then the hookworm, the way it latches in on the small intestine is very distinct. So people that work with helminths can identify them, and a lot of parents, and I promised I'd talk a little bit about the rumors, so even though I want to save time for questions, I'm going to go ahead and do that. A scientist can tell what a helminth looks like, and I've got just a couple of standard shots from a normal gut especially when parents are using strong oxidizing agents, which are now being sold to kill helminths. They're just stripping out the gut lining from the child's intestine, and we don't deny or we don't even question the fact that the parents are seeing an improvement. I think that's why they keep buying the product, is because they see an improvement. But you can also see an improvement with high-dose antibiotics. The idea there, and the most likely explanation is not that you're killing a helminth. And in these slides, on the bottom left here, you're seeing what could be mistaken as a helminth, but it's really just the edge of an air bubble. In the center bottom photo, you're seeing what's a normal morphology of the gut. It's just a ridge in the tissue of the gut that could be mistaken for a helminth. And then top right is the most common, what people mistake for a helminth is just mucus. It can come off as very, very stringy. It doesn't have any of the distinctive features that those of us who are trained in helminthology, if you will, are quite familiar with. So again, we don't question the parents' observations. I think if we question the parents' observations less, we wouldn't have this problem we have with acetaminophen. Certainly we wouldn't have had issues with the refrigerator mother fiasco and questions about does regression happen that plagued the discipline for so many years. So the parents' observations are not in question, but helminths are being killed in the gut is not the explanation for those observations. I'm convinced of that, absolutely. People have tried to find that tissue. There's a policy statement that's been published. The references down there. A very reasonable explanation for those observations is that there's a gut-brain connection, and simply destroying the microbiome in the gut and possibly even the gut lining has a temporary but beneficial effect. Now, it's definitely not recommended. You just see some benefit from it, but not recommended because it's number one, not a good permanent solution. The system's going to grow back. It could be worse than it started when it grows back, and the effects of that are completely unknown. So I know that I'm sort of giving medical advice in a way there, but I think that the field is fairly unified. Some kinds of medical advice are okay. If you're familiar with topic. So, for example, vitamin D supplementation or eating a healthy diet or getting exercise is good medical advice. With the Helminth therapy, there's a lot more complexity, and the physician really needs to be educated on the topic first. I'll point out that Helminth therapy is not immunosuppression. We've done some studies on that. Cindy Pye was in the lab for some time, did a great job with that. I'm just skipping ahead now so we can get to the questions. We'll skip those two slides. It's fundamental differences between the way Helminths work versus the way that a drug would work. This is a couple of slides on how we plan in the future to domesticate Helminths, to use them for our own benefit, much the same way we domesticate everything from dogs to chickens. There's a lot of issues about marketing that have come up. Is it some kind of evil monster? With yogurt, same thing. Is it a can of germs or is it an ingredient? And what we now know is that the ick factor is a myth. The doctors report that patients will try them. 99% of the patients will try them if they're presented in a positive light. And there are real hurdles dealing with policy, regulation, funding. Funding is especially a big issue. And I think that's it. I'll go ahead and leave it. There's some more slides just backing up in general, looking at, Helminth therapy is not an end-all, be-all. It should be in combination with other things which support a healthy immune system. And this has been known in the field of psychiatry for quite some time now. They are looking at all the kinds of things that in psychiatry that we know cause allergy, autoimmune disease, heart disease, and so on. I think I'll leave it with there's some vicious cycles going on, back to that slide, and I'll just leave it here and thank my collaborators. It's a multidisciplinary approach that we utilize to try to get to things, including sociologists, psychologists, anthropologists. We're very grateful to folks that have funded us, including Safe Minds and the Triangle Center for Evolutionary Medicine, as well as Immunities Forge. And I can take any questions now.
Okay, great. We have a lot of questions, so I'll jump right in.
I'm not surprised. We
don't have a ton of time, but we can definitely get through some of these. The first one I want to ask is, once you begin therapy, how long does a patient remain on it, or is it lifelong? How does one reverse the effect if side effects are intolerable?
Oh, so there's two questions there. So if the organisms are fairly easily killed. So as far as we know, killing the organisms, and in the vast majority of cases they're reported. Now some, especially with some of the colonizing worms, sometimes with the human whipworm, which is extremely good at treating ulcerative colitis, the patients can just get worse. But in general, the worms are easy to kill. The non-colonizing organisms, for most individuals, the effects wear off within it depends. With the TSO, it's 10 to 14 days. With HDC, it's 3 to 4 weeks. But the point is that the effects just wear off. I mentioned less than 1% of certain patient populations having a severe reaction to an HDC, those organisms can be killed. But in that case, the organism is probably growing. It's probably colonizing. Those can be killed with anti-Helminth drugs. And then your other part of your question is, do you ever get off the therapy? And again, we sort of look at it as exercise for the immune system. So if you stop exercising, then the disease will come back. I believe that's a consistent observation also. The fact that people see the effectiveness wearing off after a couple of weeks for TSO or for 3 to 4 weeks with HDC indicates that, yes, you have to maintain that therapy.
Okay.
Is that good?
Yep. The next question is about bad gut flora. So I don't know if we should talk about it, good or bad, but they're asking, when there's yeast overgrowth or Clostridia, can Helminths help in any way, or is there documentation of the fact that they can?
Right. Well, so we haven't done, said a lot of the information that I get, in fact, all of the information I get from the socio-medical study. Now, I have information from my lab rats, but it's not really what we're asking here. The socio-medical studies that we have don't really connect specific problems with the Helminth. So we would know that the patients are having GI problems, and we would know what percent can get help, but we wouldn't have individual cases to say, well, this one has too much yeast and it's being helped by this. We know that for Clostridium, the fecal transplant, it's recurrent C. diff colitis. The fecal transplant is the way to go for that. That's a kind of separate issue. The idea is that if you look at the immune system plus the worms and germs all working together, you're trying to get them all three kind of rebooted up and running at the same time, which is not necessary if all three need rebooting. And hopefully with a lot of the patients, they're only just missing their helminths and their microbiome is okay. If the microbiome is not okay, then you have to deal with two things at once, in addition to the diet and the exercise and the chronic stress.
Okay, this next question, they're saying, have you heard of any individual cases of bipolar, schizophrenia, or Alzheimer's improving with Helminths?
Bipolar, yes. Alzheimer's, no. I mean, our thinking on that right now, but obviously it's a socio-medical study, but as far as we can tell, with Alzheimer's, maybe the damage is too late, too far down. We don't, it just looks like no. And then schizophrenia, yes. Yeah, and schizophrenia even sometimes it's been shown to respond just to antibiotics. So there's a huge gut-brain connection with schizophrenia. But Alzheimer's, Parkinson's, we are very hopeful about Parkinson's. We really are very interested in that, just based on very limited data, but it looks extremely encouraging. So we're keeping our fingers crossed on that one. But it's speculation based on not nearly as much data as we would like to have for those three conditions.
Okay, the next question, and you talked about this a little bit, so maybe you could just touch on it again. They're just asking, how can you tell if it's working? So what are some of the common improvements that people have reported in the individuals who have the comorbid inflammation?
Yeah, so the comorbid inflammation, I think for allergies it's important to get the dose right. Some people are using a dose that's lower than will give them relief for allergies. Neuropsychiatric disorders is one of the big things. The main difference from TSO to HDC, and then this is the first time we're able to compare these two, and I'm working my way back up the slides to get to benefits. One of the main benefits is the neuropsychiatric, so the tics, the aggressiveness, sleeping disturbances. And again, the main difference between the TSO and the HDC that we are just now able to assess is that the HDC may work a little bit quicker, so it may take the TSO a little bit longer to kick in. And there's a physician in particular that has a lot of experience with both organisms, and that physician does not have problems with, I think a lot of people are having problems with dosage on the HDC because it's more expensive the more you use, but the more you use, the better benefit, the more benefit you get in some cases. And if you go too high, you'll get some basic transient diarrheal problems. But it can be, you should see the differences. I mean, some people say it can take 8 months to kick in, but for most people, they see some differences within 1 to 3 months.
Okay, and now several people are asking, can you say again the difference between the two, between HDC and TSO?
Well, so one issue is that TSO is very easy to ship and store. It'll stay on the shelf for years, whereas the HDC, you got to worry about shipping, and do you want to pay for rush shipping? It's less stable, and the longer it sits around, then the higher dose you're going to need. Whereas the TSO, you get what you get. It can literally, again, for years, it can sit around. So that's one of the main differences. The HDCs do tend to work faster based on the information that we have. But overall, they have the same, in fact, that same side effect that I mentioned with increased hyperreactivity. You see that with both the TSO and the HDC.
Okay. All right, I'm going to ask one more question. We've had so many questions. This question is about pandas and PANS, so that's
Yes.
strep-related disease. Have you
Yeah, the
seen
doctors
research
tell
on
us
that?
that, yeah, the helminths work better on patients with pandas than they do just on patients with autism. So that, there's no question about that. That's, we're hoping they'll work that well with Parkinson's. The physicians, their observations, what they report to me is that they get a better result. What I gave you with the positives and negatives here, that's with autism. It's better with, I think it's approaching 90% with pandas. Yeah, and that paper is going to be coming out, so I think I got the number right, but we better check with the paper.
Okay, great. And that's a good segue for me. So now we'll have a reason to have you back in 6 months or so. Once
Okay.
more information is out, we would love to hear more about this because it sounds like it's definitely moving pretty quickly. And there's a lot of new info.
There's tremendous amount of new info since the last 6 months. Of course, I don't know what to predict for the next 6. We'll see.